Welcome to Health Facts with Dr. Danesh. In this video, I will be talking about vitamin D and its different metabolites, and we're going to find out which vitamin D is the best vitamin D to take to get the highest and the fastest absorption possible in the market and according to the studies. So first we're going to talk about vitamin D and D3 biosynthesis and possible factors affecting absorption. With the help of UVB spectrum, we're going to convert 7-dehydrocholesterol to pre-vitamin D3 and then vitamin D3, which is cholecalciferol. And it's all happening in our skin, but then we are getting vitamin D3 from our diet and supplements. And then it actually enters our circulation, and then it goes to our liver, adding a 25-hydroxy, as you can see here, making it 25-hydroxy vitamin D3, and then it enters the kidneys, adding 1-alpha-hydroxy, and it makes it 1,25-hydroxy vitamin D3, which is called Calcitriol, which is an active form of vitamin D, which could respectively increase the calcium and phosphorus in our circulation. Now we know a little bit about vitamin D biosynthesis. We're going to take a look at this article published in the Journal of Clinical Endocrinology and Metabolism on 27th of October 2020, titled Vitamin D Status in Hospitalized Patients with SARS-CoV-2 Infection. And here are the results. It says in COVID-19 patients, mean plus minus standard deviation 25-hydroxyvitamin D, which is one of the metabolites vitamin D levels, were 13.8 plus minus 7.2 compared with 20.9 plus minus 7.4 in control group, and p-value was less than 0.0001, which is very valuable. 25-hydroxyvitamin D values were lower in men than in women. Vitamin D deficiency was found in 82.2% of COVID-19 cases and 47.2% of population-based control. And then 25-hydroxy-D inversely correlated with serum ferritin and D-dimer level. As you know, D-dimer is one of the coagulation factors that is actually increased during COVID-19 infection. And it says vitamin D deficient COVID-19 patients had a greater prevalence of hypertension and cardiovascular disease, raised serum ferritin and troponin levels. Troponin levels, by the way, goes up when someone has cardiovascular disease or cardiovascular attack, as well as a longer length of hospital stay than those with serum 25-hydroxyvitamin D levels more than or equal to 20 nanogram per ml. But what type of vitamin D has the highest and the fastest absorption in our body? To answer this question, we're going to take a look at this review published in European Journal of Biomedical and Pharmaceutical Science, titled COVID-19 Pathology and Vitamin D Nanoemulsion as Preventative and Alternative Remediation for Severity. Here is part of this review. A paper by Hansdotter and Monick indicated a direct correlation between low vitamin D levels and vulnerability to infections in the lungs. These may all be related to the immune system modulator effects of vitamin D, which prevents the overexpression of inflammatory cytokines while enhancing the oxidative potential of macrophages. Vitamin D could enhance the production of antimicrobial peptides found in neutrophils, monocytes, natural killer cells, and epithelial cells lining up the respiratory tract. It also says a study showed that vitamin D in an oil carrier has better oral bioavailability with greater 25-hydroxyvitamin D response than powder form or ethanol form. Nanoparticle encapsulation in colloidal dispersion could serve the needs of vitamin D against the degradation and inactivation, or to make it miscible in aqueous environment, which is water environment, The use of nanotechnology, particularly those which are biocompatible and biodegradable for such purposes, may be the best approach. It says a novel nanodispersion technology for vitamin D could mimic a bioavailability of 131%. As you know, many elderly severe cases of COVID-19 have been found with insufficient level of vitamin D. And in the absence of a cure or a vaccine, vitamin D is a safe, inexpensive, and readily available potential alternative remedy, especially for severe cases that must be tested and administered to COVID-19 patients. So the question is that, do we have this kind of nano emulsion technology in the market, or better, vitamin D3, which is an active form, in liquid form? Yes. So this is one of the best product called Demulsion by a company called Genestra in Canada. It has 30 ml liquid. Each drop has 1000 international unit with nano emulsion technology, as mentioned before. And according to the studies that mentioned in our past videos, you need to take something around 4 to 6 drops to get 4000 to 6000 international unit. The emulsion 1000 is prepared using the proprietary Wisdom emulsification process for enhanced bioavailability and improved palatability. So by taking the emulsion 1000 liquid, you're increasing the absorption of vitamin D3, which is an active form of vitamin D, up to even 100% of whatever you're taking in a day. Hope you enjoyed this video, and if you like this video and find it beneficial, please share it in your social media and to your friend and families. And like always, stay happy and healthy. Thanks and have a great day.